Hey everybody, welcome on this beautiful sunny Monday. Throwing something in the chat as we're waiting for everybody to jump on. So I really enjoyed asking people what they like about this time of year. So feel free to verbalize or put it in the chat.
Well, today in particular, it's a fall day practically.
Yeah, it's gorgeous. It was a lovely dry walk with the dog. So wearing my fabulous coats. All right. That is so true. It's nice to have those cool coats. You have to in this state. I realized that.
Yeah, if you have a cool coat too, it forgives like your whole wardrobe choices underneath, right?
Hides a lot of sins.
Yeah.
Oh, family time as always in making gingerbread houses. Same, but for scarves. All right, I'm totally in the scarves. Like I said to my husband, I need a scarf, and he looked at me. He goes, "You mean more than the like 100 you have?"
He meant you need a scarf intervention, I think.
It was pretty funny. So I just got 3 more at Land's End. They were $12 each. So cute. So.
Well, yes. Good for you. Life's little pleasures.
The simple stuff, that's for sure.
Hi, everyone. We'll get started in just a couple minutes.
I'll throw this in the chat again for people that are just joining us.
I mean, tomorrow, if it's literally going to be over 50 degrees tomorrow, it should be like a state holiday. We should. There should be some like free day or something where we can all go outside.
I used to work, I ran a family service collaborative out here in the Wayzata School District, and we worked with Evidence for Youth, but I don't recognize, I was wondering who was going to be on it if I recognized them. So, hi.
Hi, I believe my colleague JJ as well, but I've been here for about 2 years and JJ is new this year.
Oh, okay. Yeah, I've been gone about 2 years, so yeah. I'm Catherine, by the way. So.
Oh, nice to meet you, Beth.
You too, thanks.
Hi, Joan. Hi, Martha.
Hi.
Great to have everybody. We were just talking about favorite thing about this time of year, when it's actually winter. Today is kind of a funny, warm day, so. Is it snow? Is it lights? We had fabulous coats, making gingerbread houses, scarves.
It's always fun to discover like a new holiday music album or something to listen to. I just listened to Nora Jones's new holiday album. It was so good.
I'm writing that down. Thank you.
Yeah. That one's highly recommended.
I love her. I haven't heard her for a while. So I was, I made a Holly Jolly playlist on Spotify, and this year I was trying to like, oh, I was getting kind of tired. So I'm reading that chat. So that's good to know I can use some of those songs. So Clara wrote, one upside of walking the dog in the evening when it's already dark. Oh, everyone's holiday lights around the neighborhood. So true. So
yeah, true. That's wonderful. Well, welcome everyone. We're just having a little fun time chatting with each other. So feel free to join in. People are still flowing in, but I think we'll go ahead and at least get started with the kickoff. And just want to welcome everyone. Good afternoon. I'm Laurel Hansen, MACC Program Manager, and I'm joined by my co-moderator, Clara Owen, MACC Communications Director, and we're happy to be here with you today. Welcome and thank you for joining us. This is MACC Zooms in on building mentally healthy workplaces. So this is about how we work together to support our collective mental health. And this convening continues the series of Zoom sessions where we bring our members together within our network during what have been difficult times. We listen to our members and convene with them around the issues that matters to them. You responded in a big way to this invitation to talk about this topic, and this is the second in a series that we're partnering with NAMI Minnesota. It's heartening to see how you all show up for each other and with each other as a network. While each of our members has that distinct voice in the community, the MACC network is united by that belief that we have a greater impact when we partner and connect. So on behalf of your network, MACC, thank you for being here today. We begin today first by acknowledging and honoring the truth of our journey to where we are today. Every community owes its existence and vitality to generations. And we might need a mute. Every community owes its existence and vitality to generations who have come before. Some were brought here against their will, some were drawn to leave their distant homes in hope of a better life, and some have lived on this land for more generations than can be counted. Honesty and acknowledgement are critical to building mutual respect and connection across all barriers difference creates. Wherever you are located within the Twin Cities, we are on the stolen lands of the Dakota people. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, slavery, migration, and settlement that is part of this journey to today. So we have so many great MACC member organizations joining us in this session today, and you can see many of our organizations are represented on this slide. Thank you for registering and participating. In the interest of time, we won't be able to do a full introduction round, but feel free to introduce yourself in chat if you'd like to say hello. We'd love to hear from you and know who's in the room. So I think this is a good next opportunity for me to introduce our presenter today. And if you were on the previous session with NAMI, you've already met Catherine Christensen. She's an employee wellness educator at NAMI, Minnesota. Perhaps you know NAMI, National Alliance on Mental Illness. It's a nonprofit organization dedicated to improving the lives of children and adults with mental illnesses and their families. And Catherine, who we're pleased to have with us here today, she provides mental health education to employers in our community, supporting employees' mental health and well-being. She has a bachelor's of science from Michigan State, and she is committed to NAMI's mission because of her son's experience dealing with depression and anxiety. Hi, Catherine.
Hey, everybody.
Thanks for being here today with the MACC Network.
Oh, great to be with you.
Yeah, we've talked about this before. We all have compassion fatigue and decision fatigue at this point in the pandemic. And we're in a field that's all about caring for our community and for each other. And so as you go ahead and share your slides for the audience to see, I'll share that we really appreciate you being here today to guide us on how we as colleagues together, a network, supervisors, and leaders in our organization can really work on creating workplaces that value and support mental health. And this is just such a great topic for our times. So thank you and welcome, Catherine, and we look forward to your presentation. So let's hear from Catherine.
Great. Thanks, Laurel, and thanks, Clara, for keeping us on track. And thank you, everybody, for joining us today and that really warm welcome. Thank you. It's nice to be with you again. We met last month and talked about minding your mental health during COVID, and hopefully you were all able to, or those that participated, practice some of those tools. And now we're going to look at a bigger picture of good mental health in the workplace and 5 things you can do. And this is going to be about creating a culture of acceptance. So again, I'm Catherine Christensen. I'll share my email at the end, and this is your presentation. So make sure if you want to chat, just pop information into the chat room and we'll respond. And then if you want some privacy, feel free to private message myself, Laurel, or Clara, and we can address your question. So our learning objectives today are to learn about 5 things you can do to promote good mental health in the workplace. So looking at promoting good mental health, learning some common symptoms of mental illnesses, how we can change our attitudes toward people with a mental illness, learn about accommodations, and create places that foster respect and acceptance. Okay, great, thank you. Yes, chat it up. You may remember, if you attended our presentation last month, I like to start out where we do some breathing. It's a moment for us to be mindful. I'd like you to just, if you can, put aside the to-do lists and those emails that need to be answered and take this next 50 minutes for yourself. MACC is providing these wonderful programs for you. So take this as your time to center, learn, and maybe relax a little bit. So again, feel free to chat. We're going to go over a lot of information. If you have to turn off your camera or anything of something sensitive, please feel free to do that. But we're going to do 2 deep breaths, and we're going to do inhale for 4, exhale for 6. And I'd like you to try to do a deep belly breath. And I'm putting my hand on my belly right now, and I would encourage you to do that also. If you're not used to doing belly breaths, it's kind of hard to get used to them. It's a little awkward because we're used to breathing and inhaling from our chest. But the reason we want to do a deep belly breath is to stimulate the parasympathetic nervous system, and that's our relaxation nervous system. We are all under a lot of stress, especially in your industry with the compassion fatigue and the uncertainty of the pandemic. And now we're in this very hectic time of year. So take this opportunity just to practice a moment of mindfulness. So we're going to inhale for 4, exhale for 6, make a whoosh when you exhale. So inhale for 4 and exhale for 6. Deep belly breath, inhale for 4 and exhale for 6. Thank you. If you're having a particularly hard day, you can exhale with and it moves some of that negative energy. And if nothing else, it makes you laugh because you sound hilarious. So there's lots of different breathing techniques. There's square breathing, there's 4-7-8. So this is a super easy one. Practice it when you're washing your hands or doing dishes or driving. Then you can access it a little quicker in times of need. Okay, so here we go. So our goal today is to talk about utilizing the gifts and talents of all our employees. Have productive employees who carry out the mission of your organization. Have a culture that accepts differences and helps everyone to do their best. Treat mental illnesses like any other physical health condition, because a mental illness is a medical condition. And understand that recovery is possible. So let's talk about mental illnesses in the workplace. Employees may have a mental illness. Employees may have a family member with a mental illness. An executive or a manager may have a mental illness or also a family member with a mental illness. And your clients or customers may have mental illnesses. So where are we right now? 70% of people with depression are in the workforce. 35 million lost work days per year due to mental illness. Barely 57% were receiving treatment. In fact, it takes on average 11 years for an adult to get treatment. So you can see if you've got 70% of your population and those missed work days and how that ends up on your workplace and your ROI. It's estimated that $105 billion cost of untreated mental illness, and that's mostly due to lost productivity. 1 in 10 full-time employees has an addiction. People with ADHD are 18 times as likely to be disciplined for work problems. Depression is the leading cause of short and long-term disability. And people with untreated illnesses, mental illnesses, are 4.5 times more likely than others to experience an accident or a near miss in the preceding 28 days. So it's kind of some sobering numbers there. So clearly there's big benefits to your employer's experience, when treating employees. There's reduction in used sick days and employee turnover. There's improved productivity. You get more engagement, increased loyalty. In fact, I listened to a podcast in the spring, and it was talking about, in order for companies to not only thrive but survive, we really need to address the mental health and provide benefits for mental health. So you will have your increased loyalty with that, more engagement, reduced healthcare costs because you won't have all those missed days, increased satisfaction, and increased safety, fewer accidents. So the first thing we want to do is promote mental health, the first of our 5 things to do. So if we look at mental health being a state of well-being, where a mental illness is a state of ill-being, a state of well-being is where the individual realizes his or her own abilities, can cope with the normal stresses of everyday life, can work productively and fruitfully, and is able to make a contribution to his or her community. Health and mental health go together. Everyone has health and mental health. So this lovely pandemic, I chuckle because I was doing the minding your mental health during COVID earlier today. And I just say, remember back in March of 2020 when it was going to be over by summer and then fall. And here now we are in our second winter and holiday season. So we're still living with this uncertainty. We're worrying about catching it or loved ones becoming sick. There's 4 of us in our family, my husband and my 2 boys, 21 and 24. We've all been vaccinated, and my younger son and my husband, my younger son thought he had just been lifting, he and his brother had been lifting pretty aggressively. He thought he was achy from weightlifting. He got COVID. My husband got COVID. My mom, who was in town from Michigan, got it, took it back to Michigan. Nobody there got sick, but we're still in this uncertainty, even with a vaccine. So being alone or together too much again. By the end of the week, playing nursemaid and trying to keep half of us safe and running around, I felt like I was in a hazmat suit. By the end of it, I was just going, oh, I want the house to myself. So, and there's still loss of jobs and income and trying to teach children and work, because if people get exposed, we have to change. And physical distancing is hard. So that leads to stress, right? And stress impacts our mental health through depression, anxiety, mood swings, irritability. It also impacts our physical health with real symptoms: headaches, stomach aches, sleeplessness, maybe anger, low energy, being emotional. Stress can also lead to diabetes, heart disease, and high blood pressure. Excuse me, tickle in my nose. So what do we want to do? We want to take care of ourselves. Think about that work-life harmony. We talked about this briefly last month. If you were with us, we really emphasize harmony here, not balance. Balance just assigns activities to work and play, personal life, where harmony integrates it so you're more satisfied. So make a decision as to when you're on and when you're off. Do you need to stop emails at a certain time in the day? Manage expectations. How are you measuring up to your own and others' expectations? Are they realistic? Are you promising more than you can do? Remember to hydrate. Taking a sip. Thank you. Harmony, not balance. Yes, I hadn't heard that until I started working here, and it really makes sense. When do you work best, morning or afternoon? Can you structure your day to reflect this? And what do you do well? What are your strengths and how can you build on those? We really need to focus on our strengths. They were given to us for a reason. Maybe where we're lacking, that's someone else's strength. And that's another part of harmony, where we can work in balance and harmony together, each utilizing our best strengths. So addressing stress in the workplace, think about healthy coping strategies. Maybe doing walking meetings. Do a desk pedal exerciser, put that little pedal exerciser under your desk. Can you do a 10-minute meditation during a work break? Consider desk yoga. If you Google desk yoga, you will get countless PDFs with how to do yoga right in your chair. You can stand up and do some lunges at your desk or some wall push-ups, some squats, even just some gentle stretching. Maybe listen to music at work to help you stay focused and block out noise. We always want to watch our exercise, our nutrition, and our sleep. It's recommended that you get 30 to 60 minutes of exercise a day, 3 to 5 times per week. And that's moderate intensity, where you're getting your heart rate up. And it doesn't have to be a block of time. Try the 10-10 rule. Do 10 exercises at 3 different times to get your heart rate up. I just read an article, an article in Eating Well about exercise snacks, where they're just talking about 1-minute bursts where you just stand up and do some jumping jacks or just do that 1 minute of exercise. And it can really break up the routine. It has been shown to be beneficial. Even to those that are athletes, these exercise snacks can really help. It's also said that you, after 1 hour, stand up for 3 minutes and move around to counteract that hour of sedentary activity. And it was that fun, exercise snacks. I thought it was super cool. I was like, yeah, I'm just gonna have a snack. That's a healthy exercise snack. So speaking of healthy snacks, have nutritious snacks at your desk. Plan nutritious meals. Drink more water. Try to go to bed at the same time and keep a routine. When we have a routine before bed, it signals our body that it's time to rest. Check on conditions that help you sleep better. I've got the flannel sheets on. I added another blanket over the weekend. Do you need to be warmer? Do you need to be cooler? Check on lighting. Use an eye mask if necessary. if helpful, I should say. Consider those technology boundaries. Block off an hour in the morning to do your emails or the most important task. Use computer alarms that keep you on track. There's so many apps nowadays. You can do your phone, your watch, your computer. So you can set a specific time frame on how much you're able to do. And maybe you consider no emails after 6 o'clock. Create some boundaries. And it's especially important now that we're in this for the 19 months, and it's much more fluid because we're working from home. So try to set a boundary. Keep a tradition of maybe changing your clothes when you're done or doing something when you just shut down for the evening. Consider a mental health day. Do you need to take time off to relieve stress? And learn how to deal with conflict resolution. Really important when all of us are a little wound up now. And take a drink of water. I love you guys drinking and breathing the whole time. Time management, super important. When we focus on time management, we're able to practice and get more fulfillment from work. We're more organized and we fulfill our tasks with things that are of value. So do goal setting instead of seat time. Realistic thinking, prioritize what needs to be done first. There's a great brain dump activity where you just take 2 minutes and you write down everything you need to do for the day. It can be work, it can be personal, it can be a mix of both. And that helps you manage your time as well, because then you can focus on what's important. Stay connected to others. Connect with your friends and family. Don't isolate. That's been a great advantage of all the technologies. We are able to stay together through Zoom. And that can seem isolating sometimes too. So do what you can to connect. So mindfulness and meditation. Mindfulness and meditation mirror each other. Mindfulness is what we do. We do something. We take a moment, we're present, we breathe, we ground by putting our feet on the ground or putting our hands together. It's something that we do to practice mindfulness. And meditation, you can say, is doing nothing, because you take a set amount of time and you want to clear your mind. So they work together. Mindfulness can be like a little meditation snack, if we want to use another snack analogy. There's a lot of free apps you can use. Consider quiet rooms or aromatherapy. Set aside a space to relax. Practice healing practices. Take time to be grateful. Share and celebrate good things. And if you're really struggling over 2 weeks where you feel like you just are low energy and emotional and having a hard time handling pressures, etc., get help. Reach out to primary care, see what resources are available through EAP. Tell your manager if you're comfortable, if you're struggling, and use your support system to help you reduce your stress level. Encourage people to take vacations and breaks. And it does say in parentheses and make it possible. And I've been Googling, trying to find ideas on what people are doing, because everybody's spread so thin that it's hard to take those vacations and breaks. But we really need to, put your own oxygen mask on before assisting others. We're not going to be beneficial to our communities that we serve if our tanks are continually depleted. So maybe get creative, or maybe pay overtime for extra work, but try to take those breaks. Maybe you have to cut back on some services to some of your customers or clients just a little bit to improve your staff's wellness, so then they can show up for your clients. Promote those EAP resources, promote self-care tools, post the handouts that we have, share them with your, your network. Thank you. Brain cramp. Incorporate well-being activities. Reward and recognize, especially for well-being, and provide manager training.
Catherine, on the last slide there, you talked about some materials. Is your website a source for some of those as well? I know we'll be sharing some after the session,
Yes. But we have self-care tools and we have a help library. We have videos, pre-recorded videos that people can watch. And we also have the most amazing support groups if you're interested. We have them for people living with a mental illness, families of people with a mental illness, significant others of those with a mental illness, for children, for teens. There's an LGBT group. We have a BIPOC group. So there's a lot of resources on our website, and it's NAMIMN.org. And you can check on the health library, and then also under get involved under employers are some of the resources that we provide for the employers. Which is making me, yes, I was thinking, do I need to add any other stuff there? But there's a lot of great resources there for you as well. And those actually are in your goodie bag, those handouts. So, okay, so let's talk about symptoms in the workplace. What might that look like? Well, first off, we need to recognize that a mental illness alone does not lead to poor work. Just like someone that has some other illness doesn't necessarily mean you're going to get poor work out of them. An untreated or undertreated mental illness can lead to symptoms that interfere with work, though, but it's not our place to play doctor or therapist, so keep that in mind. So what does a mental illness look like? It disrupts a person's thinking, feelings, mood, ability to relate to others, and daily functioning. It is a treatable medical condition, just like heart disease, cancer, diabetes. It's a treatable medical condition. It's biological in nature. It affects the brain structure and the chemistry. There's many causes for it and can include genetics, environmental, negative life experiences, historical trauma, as well as situational trauma, as in, for example, a death in the family. It's important also to note that less than 4% of violent crimes are due to mental illnesses. And this is just a way to understand it because mental illnesses tend to get a bad rap. People are crazy, they can't work, they are violent. Okay, a question came up. So I'm jumping out here, there. Direct message. That's a good question. Someone wondered if someone has the resources to use a mental health therapist on staff to provide mental health support to the staff. I think that that would be a wonderful tool. I just wonder, I think it would be great to have it available and make sure that privacy is involved because staff might not want other staff members to know they're doing that. But I think any way that we can provide mental health services is phenomenal. And that's a super creative way if you can do it, because sadly, due to the pandemic, just like you all are facing compassion fatigue, therapists are facing compassion fatigue also, and they're either not taking people or they're cutting back on their load. So in some cases, it can be a wait of 3 to 6 months. So that's another thing that's important. We'll talk about it a little more, but just making sure that you have service, your insurance provides proper resources for your employees. So let me know if I didn't answer that well enough. So we talked about the loss in the workplace with the effects of it. And again, if we look, you're welcome, good, thank you. If we look at adults waiting on average 11 years to get help, and then we can't find help. And if we look at the fact that 1 in 5 adults are affected by a mental illness. So there's almost 30 of us on here. That's 20% of us could be experiencing, 6 people here could be experiencing a mental illness. Anxiety is the most common at 18%, depression at 7%, bipolar at 3%, schizophrenia at 1%. It also includes PTSD, post-traumatic stress disorder, eating disorders, borderline personality disorders. And mental illnesses can also be associated with other healthcare conditions such as diabetes, MS, and heart surgery. You may remember, because I always think this is so dramatic, but when you break open someone's chest in open heart surgery, that's so traumatic for the body that it can cause depression and anxiety. So what does that look like? A mental illness or depression and anxiety, perhaps overly emotional, bursting into tears, angry, difficulty concentrating or memory issues, difficulty screening out the stimuli, which I think is hard for all of us nowadays, patterns of tardiness or absences, changes in stamina or pace, decreased productivity, reduced interest in one's work, difficulty handling time pressures, stress, schedules, and multiple tasks, or those physical problems of headaches, stomach aches, racing heart, and back pain. And it's important to note that we can all have these symptoms at various times in our lives due to a stressful situation, maybe a sick child. I was probably like this last week with 2 sick people in the house, or a death in the family. This is, we want to look at a mental illnesses or being aware of symptoms that are going on for extended periods of times to notice. So what are the treatment options? They're similar. Oh, you guys, I'm so sorry. I'm so tongue-tied today. Good thing you can read since I can't seem to speak. So they're similar to physical health care options, medications, therapy. We work on nutrition, physical activity, making sure we're getting enough sleep, visits with professionals. There's quite a few different options. There's IOP, which is intensive outpatient programming. There's PHP, which is partial hospitalization programming. There is hospitalization. There's rehab after the fact. There are places in state, out of state. Our son's depression in the beginning of COVID got so bad by last November, we sent him out to Washington to a depression recovery program out there. So there's a lot of great options.
Yeah, Catherine,
Sure.
do you think that especially for those who've been personally impacted by COVID, do you think that trauma is going to cause a spike in long-term mental health issues? I mean, just even like the physical impact of COVID for, they talk about the long-term COVID people. Are you seeing or hearing anything about?
I am hearing about trauma from this, yes. And even the communities, with the disparities of the communities that are affected by it and the long term. And then what we have seen is that 34% of people that are recovering from COVID are experiencing depression and anxiety, and they think that's due to the neurological effect in the brain. So yes, there is going to be, we're part of a giant social experiment, for lack of a better term, and there's going to be things studied for years from this, but they are really seeing a lot of trauma, yes. And then of course it's harder for those of you in the serving industry with the compassion fatigue, so that makes it a lot harder also. Thank you. So change our attitudes. Normalize in the workplace, promote self-care, make mental health a priority. Realize this may impact a person's decision to disclose to a supervisor based on the fact that stigma and being afraid of raises, loss of raises or loss of promotions. So change those attitudes, make it part of the common vernacular and support it as a regular medical condition. Encourage access to treatment. It may impact their ability to cope with a family member's mental illness and accept mental illnesses like any other illnesses. So we did this before. I'm going to ask you to share slang words that come to mind when you're describing a mental illness. Throw them into the chat if you feel inclined. Crazy. It's always the one that just pops right into my head, and we use it all the time. So some others you might think of are nuts, insane, wacko, weak, yes, unstable, exactly, unbalanced. And then counteract that with a phase, perfect. Counteract that with how you think of someone that has recovered from cancer or a heart attack. We think of survivor, strong, warrior. A fun graphic, so someone's using their diabetic and medication. I don't think it's healthy that you have to take medication every day just to feel normal. Don't you worry that it's changing you from who you really are? And then here someone's bleeding out. It's like you're not even trying. So these illustrate the fact that we wouldn't talk to someone with these health conditions the way we talk to people with a mental illness. So just kind of keep that in mind. Mental illnesses are a treatable medical condition. So how can we make accommodations? There are many accommodations that can be made to those that are experiencing a mental illness and those that are returning to work. Just like any other situation, we want to be sure we involve the employee in developing them. We don't want to tell people what we think they need. But think about how you would accommodate for other illnesses with similar symptoms. So consider flexible scheduling, maybe a later start time, modified break schedule, time to leave for therapy appointments, working from home or flex space, part-time or job sharing. Think about concentration, reducing distractions, whether that's white noise through using earbuds or music, increase natural lighting, use SAD lights, modify ways instructions are given, maybe written or auditory, written versus auditory or tape recorded, provide written checklists, use memory aids, email applications, allow extra time to learn tasks. So what about those emotions? How do we help accommodate emotions? Encourage use of stress management techniques. If applicable or able to, allow the presence of a support animal. Allow telephone calls to people who provide support and refer to EAP. If people are fatigued, think about the flexible scheduling again, goal-oriented workload versus just seat time. Reduce workplace stress, allow for walks outside, provide a place for a rest period. What about that coworker interaction? Encourage employees to walk away from frustrating situations. Provide opportunities for privacy. Maybe you have an office that people can go and chat privately. Provide mental illness awareness training to coworkers and supervisors. Meet regularly. When it's a family member, treat it like any other illness. They may need time off to treat a loved one. Refer them to EAP, refer to our NAMI classes and support groups. So how do we foster respect? Develop a culture that promotes well-being, accepts and treats mental illnesses as any other illness, and communicate a commitment to this through regular conversations. Maybe you create a wellness board or walking clubs or some type of wellness activity so it isn't just a one and done. We can develop this culture, put out information, promote work-life harmony, reduce stress. I was just I'm going to say the city of Rosemont, and they did a whole program all year, and they allowed people to get points, and they got 8 hours of vacation for participating. And they had an organizational person come in and help them clean out desks. They did a whole water and hydration and health. They did mental health. They did our wellness series and finished up with nutrition last week. So maybe look at starting January with something every month. Is it Mindfulness Monday, Wellness Wednesdays, things like that. Provide and educate people on resources, encourage people to seek help, speak up about misinformation and poor language, provide educational settings, conduct free depression screenings, offer online CBT, which is therapy, cognitive behavioral therapy. Okay, understand your health plan, that network coverage, make sure parity is being met. Insurance companies are required by law to treat mental illnesses the same way they treat others. Make sure that parity is being met. Can they get in for emergency appointments? What's the formulary like? Is there a bunch of paperwork for prior authorization? Can they get residential treatment or crisis intervention? Ask for feedback from employees on the mental health benefits, and then understand your EAP benefits and measure how they're being used. And include mental health and overall wellness work. Yes, parity means treating it the same. So, and then if somebody covers appointments for a physical therapist, parity means that insurance should cover appointments for mental health therapists, things like that. So make sure that you're getting the same coverage for the mental illness as you are for other medical conditions. It's a big thing. The Kennedy Forum is working on that nonstop. There's a lot of legislation about, it's Patrick Kennedy, and he says, let's not wait for this to become a stage 4 illness, which is so perfect because what's stage 4 illness? People are dying and people die by suicide. That's a natural consequence of a lot of mental illnesses. Let's not wait that long. Make sure it's being covered. Make sure people are getting proper support. Well, as a supervisor, respect confidentiality. Ask what they want others to know. Learn more about mental health and mental illnesses. Learn to identify emotional distress and how to respond. And if performance is an issue, focus on the behaviors you're seeing and the issues at hand, not the symptoms. So I see you've been turning in reports late or something like this, not, I see you've been depressed lately. That has nothing to do, that just calls them out and creates stigma. Arm yourself with information, contact HR or EAP, learn about accommodations, share concerns. I've noticed is something going on. If you're used to people having their cameras on during Zoom and they're not, reach out to that person. How can I best support you right now? check in regularly with text or calling. As I mentioned earlier, we don't want to be armchair psychiatrists or therapists. We also want to avoid comments like toughen up or snap out of it, because if someone could, they would. As a coworker, arm yourself with facts, listen, demonstrate support in little ways, maybe send notes, drop off a card at someone's desk, drop off food. Don't make an assumption about someone's health. Protect your organization's commitment to staff, or sorry, protect, but more importantly, promote your organization's commitment to staff well-being. It's important to talk about this. Again, we don't want to make this a one and done. If there's any silver lining in this pandemic, it has raised the awareness of the mental health issues. It played out on the national or the world stage at the Olympics. We need to make sure we're supporting people. Include your friend and coworker in your plans if you're going out for lunch or going out for coffee or taking a walk. If someone seems isolated, just reach out so they know they have support. So what can you do for your mental health? Develop a routine, especially for sleep. Don't forget physical health. Stay organized. Make time for yourself. Utilize resources that are available through your network, your EAP, resources like NAMI. Consider changes in work environment. Do you need to move to a different place? Do you need to change companies? Understand that nothing is perfect. We like to say, give each other grace and space, and give yourself grace and space. We're in really hard times right now. And seek help. Don't be afraid to call EAP or NAMI.
Hey, Catherine, you were talking about things we can do, and earlier you commented on different types of breathing exercises, and I've heard the basic one that you had us demonstrate, but I haven't heard of the different types of other types of breathing exercises that you mentioned. And I'm wondering, where's the best place to find resources on those different types of breathing exercises?
The best place is really Google. Just Google breathing exercises. And I think the best thing to do then is to find one that works for you. I personally don't like holding my breath. That stresses me out. So the 4-4-4-4, or it's called square breathing. That's a very, very common one. And that's inhale for 4, hold for 4. Thanks for bringing that up. I said I was going to talk about it earlier and I didn't get back to it. You inhale for 4, you hold your breath for 4, you exhale for 4, you inhale for 4, and you do it in a square. And it's a great tool because you can remember exactly where you're supposed to be. The Calm app has one, the free one. You can do Calm for free with, there's some commercials, but it'll breathe with you. It tells you when to inhale, exhale, and that's more of a circular one. And then there's one called 4-7-8. That's a pretty common one also. My son likes that one a lot, where you inhale for 4, you hold for 7, and you exhale for 8. And it's really just finding one that feels really good and comfortable for you. Yes, the box breathing, square breathing is really easy to remember. Thank you. And so those are good ones to try out. And then again, and the Breath app on their Apple Watch. I should use it more than I do, right? We all should be doing this. So we don't want to shoot ourselves to death, but anything that we can do, there's just a lot of free resources out there. Yeah. There's Headspace also.
Yeah. What is that physiology around breathing techniques, and is it about focus? Is it actually about oxygen, or what makes it work so effectively?
What makes it great, it kind of covers all of that. It brings you to the present moment. It brings you back to your body so you can get away from some of that stimuli. When you do the deep belly breath, it stimulates our parasympathetic nervous system, which is our relaxation system. So if you practice it regularly, you can actually, and because I teach these classes, I've gotten not really great, but I mean, I do it regularly, and I can honestly, from practicing, I can say I'm a true testament that it works. I can get myself into a relaxation mode really quickly, and it's really, really wonderful with just the 4 and the 6. It also helps you just stop and notice what's going on around you, to take a step back, and then you can assess. You can reprioritize if you need to. You can relax. It's good for your brain. So it does cover many aspects. Did that answer your question? Okay.
Yeah.
So thank you, because I was going to bring that up. This slide, this presentation doesn't have another breathing slide in it. So, but super important. I would say again, that's one of the biggest take-home messages from all the classes I teach is to practice the breathing, because it can really, really, really help you. So good. Grace and space, breathe, self-care. Chat, another chat here. Yay, thanks. So we always talk a little bit about suicide prevention in our presentations. As an employer, oh, someone raised their hand. Hold on a second. Thank you.
I have a quick comment and maybe a question.
Sure.
We have one member organization that I think has gotten really good, and I'm kind of admiring them. At kind of building into their organizational culture, like breathing, like opening all of their organizational meetings with a breathing exercise, which I'm just like, it's a pretty big commitment, you know, culturally for the org to kind of head down that path. I'm wondering about if, you know, breathing is such a helpful tool. How have you seen folks kind of build that into organizational practices like that? And like, I don't know, I just thought that was a really interesting approach, and it's now just a part of how they do their meetings all the time.
Yes. I have seen companies start their meetings with those. I learned it from, in my previous job, I worked on adverse childhood experiences and being trauma informed. I was a trainer for that. And I got it from Mark Sanders, who's with Minnesota Communities Caring for Children. He always started his presentation with some breathing. And I thought it was so great. And I see we had our state conference the end of November. One of the speakers started one of the presentations like that. But it really helps when you have someone from the C-suite or down, or a manager or a supervisor start it and lead the charge with that. But once you get used to doing it, it becomes commonplace. And again, it's just a moment of mindfulness. So if there's any way you could do it or suggest it, I would just try it out. It's a really great tool. Did that answer or help or share and everything? So good. But yes, I have seen people doing it. So in fact, I'm the one that started it, and my boss is like, no, I'm going to use that now in my presentation. So yeah, you just have to plant the seed and then take it from there. So suicide is death by suicide. We don't want to say committed suicide. We say death by suicide because they are not committing this act. It is a consequence of this illness and disease. But be aware of the warning signs: suicide threats, preoccupation with death, no hope for the future, self-loathing, unexplained anger, social isolation, changes in hygiene, alcohol or drug abuse, prolonged depression, making final arrangements, giving away possessions. Yes, thank you. Yes, any other questions? Unmute and pop in. We do QPR, question, persuade, refer. It's CPR. Basically, it's CPR for suicide, they call it. The analogy QPR, CPR. It's recommended that anyone over the age of 16 take it so you can know what to do. We have public awareness presentations twice a month on our website, so anybody can take it. So to save a life, that's what we talk about. You express empathy, you offer hope, you reach out. Are you feeling suicidal? Asking does not increase the risk. Listen non-judgmentally. Let them know you care and you will assist them in getting help. Don't try to do it all yourself. Get mental health professionals and others involved. Don't promise secrecy. If you were in my last presentation, we talk about this at the end of most of our presentations. Don't worry about being disloyal. You'd rather have someone here with you and mad at you than promising secrecy and them dying by suicide. And if you can't persuade them to stay for just a little bit with you, call hotline or emergency services. 95% of the time, suicide is generally a short-term. I mean, people may be planning it and you want to watch for the warning signs, but if they're going to die by suicide, there's about an hour time frame where it's really intense. So you want to stay with them through that and get them help. So there are lots of resources available. You can put ** crisis in your phone. You can text MN to 741-741. The National Suicide Hotline is 1-800-273-TALK, 8255. Those are all manned 24/7. If you do call 911, try to remember to ask for a crisis intervention trained officer. If you don't remember that, say it's a mental health crisis. That way you will get someone that won't be showing up to use force. And look up your local county crisis number. So we talked about those 5 things: promoting good mental health, the common symptoms of mental illnesses, changing our attitudes towards people with a mental illness. We learned about some accommodations, and we talked about how to create places that foster respect and acceptance. Oh, good, thank you. Trisha put in a bunch of other trainings. Awesome, thank you so much. We have so many classes and trainings, and we have pre-recorded information on our website also. And then we do these types of classes as well. So we provide education, classes, booklets, fact sheets, suicide prevention, support groups, everything we've been talking about. We legislative advocacy. If you'd like to support us, you can advocate for a better mental health system. If you're passionate about legislation, please join us. You can attend an event, sign up for a newsletter, join one of our affiliates, be a sponsor, volunteer, or become a donor. So now I just want to remind us all that in times of stress, none of us sometimes are not at our best. So think the best of people. Give people grace and space. Give yourself grace and space. Now I'm just going to open up the floor to questions and comments and needs.
Thanks, Catherine. You know, I thought it was interesting. You said that 1 in 5 people are impacted by a mental illness. I think that was the stat.
1 in 5, 20% of our population.
And yet to me, that sounds low at some point in a person's life. That's still, does that reflect that some people are just always undiagnosed through their whole lives?
It can be that, and it's more of 1 in 5 for a mental illness, because we all do have times where we're depressed, where it's a short-term situation, but those that live with it on a regular basis, where there is hope for recovery, but it is something that, like right now, our son is doing well, but it's always there. It's an illness that he always has to manage. So it's a longer, bigger picture, 1 in 5% of the population.
Mm-hmm.
Does that make sense?
Yeah, it does. Yeah, I think it'd be interesting to hear from any of our attendees too, is if in their workplace they've ever been in a situation, obviously being thoughtful about being anonymous, but where they've ever, you know, been handling issues with their colleague. And, you know, I'd love to hear about some of those workplace examples. I see a question in chat for you that's
and so usually if you reach out to there are clinics in the city, and if you reach out to your county, they can provide you with resources for those that do not have health insurance.
So you think the county is a good source for that?
A great source. If you don't, for example, if you're in the western suburbs and it's a teen clinic, My Health Teen Clinic provides resources, mental health resources for all spectrums of insurance, no insurance to full insurance. So they will work with you. But the county can get you short-term crisis intervention therapists, and then they can help direct you to those that, for those that don't have insurance. Great question.
You provided some resources that, as I mentioned earlier, we'll be including in the e-goodie bag. I don't know if you want to say anything about any of those, but.
Well, there's some great things on good mental health in the workplace, how to publish it, what to look for, and the one goes over most of the stuff that we discussed on identifying the signs, taking care. It covers all the 5 things, the accommodations. So it will recap everything. I would like to pop into the chat. First off, my contact information, longest name, title, and email address, but you can reach me at NAMI Wellness Educator at NAMIMN.org if you have any questions. And then you can always reach out to NAMIMN.org, our website, or our NAMI Helps, and they can direct you. There's also a company called Fast Tracker. And that will give you resources. It will give you therapists in your area, not necessarily free therapists, but that's a way to find a therapist also.
Fast Tracker.
Yeah, fasttracker.org. And there's, I just popped into the chat our evaluation for the end, if you wouldn't mind doing that. And then Laurel will send that out also.
Yeah, it'll be included in the
Yes,
goodie
in the
bag.
goodie bag with the other handouts.
Yeah, along with the recording of the session. We always say that you know, you found time in your schedule to come to this Zoom, and we appreciate that. But we also think that maybe these tools you can share in your workplace to those that maybe weren't able to attend.
That's a
There's
great idea.
another question in chat. Has anyone had any luck with virtual counseling resources for staff? So that could be a question for anyone in the audience.
Anybody, right?
Yeah.
I would say that's been very helpful with the Zoom, and it's been a great way to get into someone faster from what I've heard. But I don't know about Talkspace specifically.
I just keep seeing ads like and hearing about it on the radio or something, and I'm like, I wonder. I've thought about one, you know, if maybe they don't have like wellness plans you can buy into as an employer. I've been curious about it. I just didn't know maybe anybody on the call had encountered this, but it could be a creative solution for like part-time staff too, to have that as a low cost benefit. I'm not sure. Might be something to look into.
That's a great idea. I'm actually going to call them. I would suggest if you're looking for something for your staff, just call it and question. I think I'm going to do that too, so I can provide that resource for others as well. That's a great idea. Thanks.
Yeah.
Because I've just heard it's come across my desk that it's working, but I don't know any specific companies. So.
Yeah. Well, your presentation was a wealth of information. I appreciated the whole perspective of what we know, what we can do as a community and as a workplace. These are difficult things, and it's just helpful to have that knowledge and to have the support of everyone and know that there are resources available. Also really greatly appreciate everyone's participation and attendance today and sharing in this discussion with our network. And thank you, Catherine, so much for returning to the MACC community. Appreciate your knowledge and expertise and just your willingness to personally share your story. It just really helps a lot. So thank you so much.
Well, thank you. Thank you for your patience when I had another class right before this, and I clearly made a difference. My throat was dry. So thank you.
That's winter for you.
It's winter, I know. So, well, and I just wish you all super happy holidays, and take care of yourself and make time for yourself and practice that breathing.
Yes,
there's a lot of chaos around us. So
that's my takeaway for sure. Everyone watch for that e-goodie bag email. Feel free to share the resources with your colleagues and your organizations. And we do have a couple of MACC Zooms in planned for January. So watch for invitations to those. This brings us to the closing of today's Zoom conversation. And of course, we want to know what else you'd like to talk about in 2022. So feel free to drop us a note at any time. Really anyone at MACC, but feel free to reach out to myself or to Clara and let us know what you'd like to talk about on Zoom in 2022. And this concludes our session for today. So everyone, please be well and best wishes to everyone. Thank you so much.
Thanks for all the nice comments in the chat. Take care.